And also, maybe some of the more stuff which is a softer side of medical innovations, this often gets discussed. Which food groups are right to use? What do we mean by the gut microbiome? And also, what other implications does it have when it comes to improving our health overall? So, if we're set for the stage, which I believe that we are, we're just going to make sure that we've got our microphones coming to join us. I'm going to be inviting my panelists to come and join us on stage. We're just going to make sure that we've got all our speakers and panels here. We've got a couple more sessions coming up. Later on, I'm going to be speaking to a group of specialists when it comes to maternal mental health. Please do join us for that. We've got another MOU signing and some special presentations as well. Our programming continues for another 2 days here at Arab Health. You can find the details on our website and also on the side of our stand as well. There's some more information, some really exciting firesides, panel discussions and presentations, and always with the leading experts in each field. We are very privileged that they've taken the time out to speak to us. So I see that the stage is set. So without further ado, allow me to please introduce my panelists, and if I can ask them to come and sit underneath their names. Dr. Pranab Gawala, who's a consultant gastroenterologist at Mubadala Health. Please do give him a big, big round of applause. Natasha Ajaka, who's a senior clinical dietitian at Mubadala Health. Give Natasha a round of applause. And Farah Hilu, who's a wellbeing counsellor and nutrition specialist at M42. I'm so excited to be speaking to you all. Now, the emphasis on this session is you hear less from me and more from my experts. And also, we are going to be opening it up to audience participation. Please do have your questions ready. We really want to make this as interactive as possible. My panelists are super approachable and have promised to answer every question. Make your questions hard and technical. Now, to begin with, may I please just go through my panel and just ask you to describe for us why is the nature of the gut microbiome important for us to be looking at today?
Thank you very much, and welcome everyone. I think it's important to start with understanding what the gut microbiome is. Not many people realize that the gut microbiome is all the bacteria and including the viruses and the fungi as well that's inside every one of us within our bowels, the large bowel. And not many people realize there's almost 1,000 different species of this. And incredibly, it weighs about 1 to 2 kilograms in each and every individual. So this is the thing that most people hear about, the good and the bad bacteria. So this is what they're all living within you and doing an amazing job. And you're going to hear a lot more about what they do. Just to leave you with the thought that what they're actually doing is producing in their daily activities a lot of chemicals, metabolites, what we call metabolites. And some of these you'll hear about later has a profound effect on health. Things like antioxidants, which most people are familiar with and go out and buy in the shops. The bacteria that you hold within you have the capability of producing some of the most powerful antioxidants, provided you feed them appropriately. And that's what you're going to be hearing a lot more about.
Thank you so much, Dr. Pranab, for that overview. And often they're described as the friendly bacteria, I believe. And to bring in Natasha, again, the gut microbiome, why is it so significant for us to be focusing on?
It is, from a diet point of view, from a diet perspective, they're very closely connected. You'll be impressed. The deeper you go into this field, the more impressed you will be by the impact of diet over gut microbiome and how it shapes it. So, for example, let's say we have a high intake of fiber, and this high intake will actually help and support the fiber digesting microbes that are in our gut microbiome. And it's very well connected as the other side of the blade, the other edge of the blade. For example, a high intake of processed food will lead to a high inflammatory rate. So it's
fantastic. So they're very responsive and reactive to what you put into your body. So that's good to know. We're going to come back to exactly what foods you recommend from your expertise into diets. Now, Farah, to bring you in, when it comes to well-being and nutrition, What's that got to do with the gut microbiome?
Yes, absolutely. And I think one of the main reasons why the gut microbiome is such a hot topic nowadays, it's because of the fact that we are able to better understand using cutting edge technologies the impact that our microbiome has not only on our digestive health, but really on our overall health. So we know that there's that gut-brain axis and how the gut microbiome can impact your mental well-being. It can trigger anxiety, depression. There's that gut, as I mentioned, the gut-brain axis, there's the gut-skin axis, there's the gut-lung axis, there's the gut muscle, bone, thyroid. So the gut is really linked to every single organ, and it can help regulate the immune system, metabolic health. It can help regulate genetic expression. So I think the fact that, again, we are utilizing cutting-edge technologies, innovative technologies to better understand what does the microbiome constitute and what functions do these different microbes have and how they can impact health.
Fantastic. And we want to do a deep dive into that cutting edge technology with you in just a moment. But let's set the scene. I'm going to come back to Dr. Pranab. We talked about the significance of the gut microbiome. What's going wrong? What are you seeing in your experience that patients come to you with, which then we need to address with more kind of intervention when it comes to diet and technology?
Okay, for this, I think I'll focus on one of the most common conditions that we in gastroenterology experience, and is actually very common even within this part of the world. In fact, most of the world. That is this common condition called irritable bowel syndrome, for instance. This is a condition where there's a lot of bloating, abdominal discomfort, and what we are now picking up is quite fundamentally there's a disruption to the gut microbiome that's at play. This is where the technology that you're going to hear about is now helping us understand it a lot better, understanding the dysbiosis, what we call the dysfunction that's contributing to it. And just 2 years ago, there was a huge presentation at the biggest American conference, which really highlighted, which concluded, they presented a study of 5,000 patients where they looked at the gut microbiome and using precise probiotics prove how useful altering the gut microbiome in this select group of patients was, and the benefit was quite apparent. And both the American and the British gastroenterology societies really highlight the importance of the gut microbiome, and that's, I think, we're just starting to see the acknowledgement of the gut microbiome, and through the technology realize which particular bacteria are having a big influence, and how with precision probiotics, precision foods, we're going to make a big impact in this area. So
I think that's a very illuminating study that you refer to there, which gives us a real insight into the nature of the problem and the scale of the problem as well. You seamlessly have now set the scene for Natasha to talk about that precision intervention when we talk about probiotics and diet. So what are some of the interventions that can be recommended to patients to improve their gut microbiome?
First, I'd like to start by saying why prebiotics and probiotics are important. They feed this gut microbiome. They feed it in a way to not only have byproducts after the fermentation and the breakdown. For example, short-chain fatty acids are a byproduct of a fermentation, which improves the growth and of this friendly bacteria, if we might call it.
And to make sure that everybody is on the same page, what do we mean? Which food groups are we talking about?
Yes, basically these are the kefir, the yogurt, green leafy vegetables. Also, Dr. Pranab mentioned the antioxidant. Basically, the high fiber food are also high in polyphenols and prebiotics and probiotics. Dark chocolate, which everyone would like to hear, are high in it. Antioxidants. Also, the other edge of it is the processed food. It's not only about what you eat, it's also about what you don't eat. Processed food, sugary food, which the byproduct will negatively impact the entire metabolism and the body overall.
And that's a really interesting point you make there. It's what you tick and what you cross off as well. And to just explore that point you make about the process and the over sugary stuff, the reason some of the topic area is possibly known to our audience is because often in magazines you read about the probiotics that one should be having, the commercial ones, the ones that are in a little bottle and you just drink them on the go. But then, of course, new research comes out that says that those are problematic as well. They can be high in sugar and highly processed in themselves. How do we navigate all this information?
First of all, there's a team that can help on that by also teaching us how to read the food label on or the supplement fact on the back of it, know what's in there. If, for example, you got one you're not sure of, some designation or some names you might find very complicated, but it actually can be good or can be bad. You have doubts. Not everything can be taken. Not everything should be taken on the spot. Even if it's over the counter, it doesn't mean it's the right hit for you. So it's a big decision to make what you take in supplements. I think Farah, are you the supplements? You can cover this part as
let's
well.
bring in Farah on that point, and also to say that so Dr. Pranab could be possibly the starting point to diagnose the issue when we have that dietitian expertise in terms of actually a little bit more education to help us navigate what we should and should not eat. Farah, if you can come in about the supplements, and also let's bring in the technology now. I think this is the point in the discussion. We can talk about what M42 are bringing to the table.
Sure, absolutely. So we utilize what we call shotgun metagenomic sequencing, which is, again, very advanced sequencing. And the way that, it stands out really in many ways, but the three key ways, first and foremost, we're looking at the microbiome as a whole. So we're looking at, not only bacteria, but archaea, yeast, protists, etc. We're looking at strains. Okay, so the taxonomy of microbiome, the closer, let's say, as you go, it gets more specific. The characteristics of microbes get more specific, and that's where, you mentioned probiotics. Usually we purchase probiotics over the counter, but there are certain strains that have certain functions and are meant for certain conditions, whereas others will benefit other conditions. So this is where precision medicine and precision probiotics comes into play, right? And this is when we utilize shotgun metagenomic sequencing, we are looking at the microbiome at a strain level. So this is very specific and quite accurate. And then just as important is the functionality. So what are these microbes doing? What functions? What are their actions? And they produce, as my colleagues mentioned, short-chain fatty acids, which have an anti-inflammatory impact on health. They can cross the blood-brain barrier, reduce inflammation, promote brain health. They can help regulate weight. They can help balance blood sugar levels, reduce the risk of chronic disease. On the other hand, certain metabolites are pro-inflammatory, right? So you have LPS, TMA, those can increase the risk of cardiovascular disease, diabetes, neurodegenerative disorders. So again, this is where our technology really helps us better understand an individual's gut microbiome. Leveraging artificial intelligence, then we are able to of course, compare it to a reference population, which we've done to validate the data, and then develop reports that are very personalized to that individual. Because yes, we say, probiotics and prebiotics are fantastic, but sometimes there are certain types of prebiotics that an individual won't be able to tolerate at that point in time. So, the recommendations that we get from our report and our testing is very accurate, and then we further personalize it for the individual based on that thorough assessment that the physician and the dietitian and the counselors, nutritionists do.
Thank you, Farah. I think it's really good for us to understand the nature of that personalized and precision health care that you outlined there. I know Dr. Pratap wants to add a point, so please come in.
I'm just going to add something to what Farah said. Now, if you look at the Dubai market for probiotics, there's about 70 different probiotics available out there. And I've looked through them, and it's very difficult for me to look and see what would suit a patient, let alone anyone out there who hasn't really looked at the research behind some of the bacteria that's promoted in these. So for instance, we talk about the study I talked about, the largest study in irritable bowel syndrome presented 2 years ago. The particular bacteria that was identified that really was very useful stood out amongst all the others. Now, that's not commonly known and not commonly used in the probiotics here, but there are some. And so you have to be very careful what you go out for and what you get. The market is really understanding it, but it's not mature enough to really identify precisely what. And I think the technology, as you say, is really helpful, helps me identify in a patient the kind of the populations that the patient has, and then can identify if there's a deficiency in certain areas, then you add to that. So it's really helpful. The technology, the market is there, but it's not mature.
I think that's really interesting, that powerful point you make about you going into a supermarket and assessing the nature of the food. So what kind of chance do we have? And that's where I think you do need to speak to trusted medical advisors as opposed to some of the pseudo-medical advice that we can find out there, which is why a panel like this is really special. And on that note, would any of you like to put a question to my very special panel? Don't be shy, brilliant. We've got one right there, and we've got the gentleman in the brown suit straight after. And please do, we've got a lot of time on the clock. I opened it up especially early for you. Introduce yourself and who your question is for, and keep the mic all the way up, all the way to your lips.
Hello, I'm Fatma, and I'm from a research background, and this is really interesting. I was wondering...
Sorry, the mic all the way like this. Yes.
I was wondering mainly for a pediatric point of view, where a lot of people talk about autistic children and how they can help them with microbiome and gut health. And do you have any input towards that? And is that even possible?
Fascinating question. Thank you very much. And we'll give the mic to the gentleman in the brown suit. Who would like to take that?
That's actually a very good question to highlight the impact of microbiome in pediatrics. It is actually so far, it's very effective. Studies are actually ongoing, but from a nutrition point of view, the more and the better you feed the microbiome, the better outcome when it comes to, as we mentioned, the cognitive functions and even the emotional well-being. So overall, if you have in you or byproduct that are healthy and that will help support the cognitive function, whether in autistic children or children without autism, it also helps them. So a lot of studies have been made and developed around this topic. It improves. We have the gut brain axis, as Farah mentioned as well. It's a very close communication between them, whether in kids or in adults as well. So that's why the studies are ongoing regarding that. Plus, looking at overall nutrition is also key.
Fantastic. I'm going to bring in Farah and Dr. Pranab on that answer as well.
Sure. I just wanted to add, there is data to show that children on the autism spectrum do have dysbiosis, so an imbalance in their gut microbiome. And of course, on the autism spectrum, it's very multifactorial, right? But the gut health component is critical, and there are actually clinical trials that are being conducted in terms of fecal microbiome transplants on children on the spectrum to see how this could potentially help modulate their gut microbiome and in turn improve some of the symptoms or behavioral aspects, etc.
Thank you very much for that. And Dr. Pranab?
I'm going to take this a little bit slightly different. I can't comment on the autism side, but I'll leave you with the fact that actually there is an impact with the gut microbiome and the brain. Interesting study ongoing in the Australian Army looking at how probiotics or how food is impacting your ability to concentrate, focus, is ongoing. So it's not something that's just being left aside. It's very, very much on the minds of people who need to be very well focused and very with the best ability to concentrate. So it just tells you that there is a lot we have yet to learn, and what we're going to learn in the next few years is going to be absolutely fantastic.
And those studies that you cite there, Dr. Pranab, presumably they're also done on athletes as well. As you said, people who have to be at the top of their game every single day. Of course, that kind of information is super useful for the likes of us. We can apply it to an everyday basis. The gentleman in a brown suit, you were very patient. You had a question. And please, do anybody else have a question? Brilliant. We've got then two people behind. So first with yourself.
Thank you very much. Thank you all. I really enriched my CME in microbiome science. I am Azam Kayasif from Dubai. I am gastroenterologist. I am friend of my colleagues.
Brilliant.
And I
Please
am
do
a
bring the mic
clinical-
all the way to your lips.
And I am a clinical microbiologist.
Why do we not have you on the panel today?
Maybe in the future. First, you did very nice review. As she said about autism, let us take as prevention. If we take care of the first 1,000 days of life of our children, that meaning they will be healthy and without any problem. That meaning the most important is not the newborn gut microbiome, is the female or the woman gut microbiome, vaginal microbiome and all. Now, all the study done outside. And I am pushing to do our own study because our disease, our phenotype disease is different. Our phenotype IBS is different from outside. Our phenotype, I'm talking about UAE and the others, our phenotype IBD is the different. I started to do it during COVID with Khalifa University, UAE COVID-19 microbiome signature. And we succeed a lot in why some people with COVID-19, they are very good and the other not. That's meaning how the rule of gut microbiome. The last point, I am against prescribing prebiotic and probiotic blindly. We should first test properly, and according to that, we'll give precision microbiome medicine to each patient. Thank you.
Fantastic. Thank you very much for your intervention there. And I think that you make a very powerful point about having better global representation and therefore better prevention as well. Would you want to put your colleague on the spot? Would you like to respond? And then if you can get the mic ready with the lady.
With Dr. Azza, I think we completely agree. We should really assess a patient first, understand what their gut microbiome holds, and then offer them the appropriate probiotic or the appropriate diet. That's where precision nutrition is going. I could talk more about how AI is being incorporated into this whole thing of individualizing patients' microbiome and utilizing AI to really harness databases far better than what we can now, but that's for another talk.
No, that's really interesting. And as you say, it is about that, enabling better access via AI, but also inputting into AI the data in the first place from a greater global representation. Let's please bring in the lady, and I will let you all contribute answers as well, but I want to get as many questions in as possible.
Thank you. My question goes to Farah. What is the general cost of a full assay for a patient to get this?
Brilliant question. The lady goes straight to the nub of the question. How pricey is this procedure that we're advertising?
I don't think I'm at a position to answer this right now, but my colleagues at the back can definitely help.
A very diplomatic answer. This is accessible to
Absolutely.
everybody. Okay, so it is
Yes,
accessible.
absolutely.
Okay.
It's very easily
so this
accessible, and
information that we
can
will
have that
try to
discussion,
share,
absolutely.
please do get the lady in person. And we had a gentleman behind. Can we please pass on the microphone? Okay, but then short and then short.
Sorry, we are seeking actually to make it as accessible as possible at the center. So
She's guaranteeing a discount. That's what she said.
yes, I am.
Yes, just a quick question from me to the whole
Mic
panel.
all the way up.
All the way up, thank you. Testing 1, 2. Okay, brilliant. In regards to oral health and the gut microbiome, I know you guys spoke about gut health, but we know oral health is a direct contributor to, the gut health as well. Is that point generally overlooked with healthcare professionals as a holistic treatment pathway? Because oral pathogens can enter the bloodstream and then cause chronic disease. So maybe there's something needs to be incorporated holistically.
Brilliant.
But I thought
That's
I'd
a
raise
really
that.
good question. Thank you for opening up. Can we get the mic to the gentleman so it's ready? Thank you for opening it up. Who would like to take that question about, are we considering oral health when we talk about this subject matter as well?
Yes, I mean, the whole field of microbiome research is growing by the day, okay? And we recognize the importance of not only the gut microbiome, but the oral microbiome, the lung microbiome, the skin microbiome, the vaginal microbiome, and how all of these impact health. Now, we are definitely looking into incorporating in the near future more microbiome, maybe oral microbiome testing. But ultimately, whenever we do our counseling, there are some red flags, let's say, when we conduct our gut microbiome testing that can signal that something is not right in the oral microbiome, even though we're not testing it per se, right? But there could be some red flags, and this is where we through integrated collaborative care, we can refer them.
I think that's really reassuring to know there is a holistic response when a patient comes in. The gentleman's be very patient, so very quickly, please.
Thank you. Nick Losseff, neurologist, Cleveland Clinic. Where does SIBO fit into all this?
Okay, thank you. Did you understand that where does
Small intestinal bacterial overgrowth.
Now, SIBO fits into a little bit more pathology side, where you actually have overgrowth of bacteria within the small intestine, where there shouldn't be that bacteria. The microbiome which we're talking about is very healthy and very natural and should be present within the large bowel. If a lot of that, even if it's healthy, gets into the small bowel, you will suffer consequences of it, and it will be obvious. So you should. That's a organic pathology which we do something about. So.
Okay, thank you very much. So Dr. Pranab took the last audience question there, so I'm just going to give the ladies a chance to also have a few last words here. Very quickly, we've got only 30 seconds on the clock. Some good foods. What should we look out for? Not names. Yogurt, kefir?
Yogurt, kefir, green leafy vegetables, high fiber food, whole food. Limit your processed food intake.
And the most fun? Dark chocolate.
Dark chocolate. Yes,
We
indeed.
need to distribute that at the M42 booth.
That's
People
stuck
take
to the
note.
mind.
And let's give the final note to Farah. Technology, is it the key to unlocking the possibilities of our gut microbiome?
Absolutely, because the more we know and the more in-depth information and data we have, and again leveraging AI, we are able to make those associations, those links in terms of building more personalized care for the individual.
Fantastic. That's such an empowering message to end on. Yes, there are some issues that we need to address. There are interventions that we can make on an individual, everyday basis, and technology could be the key to the future. Thank you all. Thank you to our audience. A big round of applause to our wonderful panelists there. We could talk about this for many, many hours. We're going to take a photograph and then dive into our next session. So please do join me as we thank you so much.